Okay, I get asked this question all the time. How long do dental implants last? So dental implants have a very high success rate, around 95 to 98%. But yes, in some cases, an implant can fail. Most failures do happen early in the healing phase if the implant doesn't fully bond with the bone the way we expect. Less commonly, problems can happen years later if the area gets infected or if the bite overloads one of the implants. Signs of a problem could include looseness or movement of the teeth. So call me if your teeth are loose. If you have pain that gets worse instead of better, or if you have any bad swelling around the implants or the gums. If you feel like something's not fully seated or if your bite suddenly changes, call me right away and I'll check it out. If something like that does happen, don't panic. Even if one of your implants is failing, it doesn't mean that the whole case is ruined. What I normally do if an implant fails, if one specific implant fails or isn't healing properly, sometimes I have to remove that implant, clean the area out. Sometimes I'll place a small bone graft to make sure that the jaw regenerates. And after it's healed, sometimes right away that same day that I take the implant out, sometimes a few months later, I'll place a new implant once everything is ready. In most cases, this doesn't affect the entire set of teeth. Usually the temporary teeth can still stay in place and be worn, and I might have to adjust them, like shorten them a little bit, but you can still function and smile while we're getting through this little hiccup, okay? So long-term failures, meaning not right away after your surgery, but years later, those problems are normally due to smoking, or if there's been a change in your health, like diabetes or an autoimmune disease, if you grind or clench your teeth, or if you're not keeping the implants clean. If you're missing your dental checkups, you gotta come see me twice a year at minimum, right? If you have extra stress on your bite through grinding or something like that, that can also cause problems. So like I said, diabetes, autoimmune diseases, and other health changes can also affect how the gums stay healthy. So it's very important that you come in and see us a couple of times a year so I can keep your implants healthy and strong. You know, given enough time, almost anything can wear out like a car. And so if we keep up with things, mitigate the risks, and you come in and see me every 6 months-ish, I can try to make sure that you keep your implants for as long as possible, okay? I once had a 90-year-old patient ask me if these implants were gonna last the rest of her life. And I said, absolutely. I know that will last you the rest of your life, all right? I had a 20-year-old patient ask me the same question. Are these gonna last me the rest of my life? And I said, no, they're not. You know, if you live to be, let's say 90, it's not gonna last you 70 years. Everything that we do has a lifespan. And so I want your case to go as well as possible, last as long as possible. And so I'm gonna do my part to do a good job at your surgery and to keep your bite perfect. And you gotta do your part and do a good job of cleaning and coming back in to see me. In case something happens, we can fix it early, okay? Thanks for listening.